Good morning. I thought I'd bring you on my walk this morning. The weather's really shit, so I was going to do a walk down the beach. However, it looks like there's going to be more rain. We've been getting a lot of rain lately here in Newcastle. So I thought I'd just take you on my local area on a walk and we'll have a little chat about diabetes. So diabetes mellitus coming from the Latin word meaning, or Greek word, meaning sweet. So the pancreas is an organ which is situated just right behind your stomach and in front of your spinal column. It's an organ that's got a head, a body, leads into a tail. It has a lot of functions as far as the endocrine system goes, but also the digestive system. And it has these cells called the islets of Langerhans. I think I've pronounced that right, or islets of Langerhans. And they produce about 4 different really important cells called alpha cells, beta cells, and there's 2 others. I think one's called sandostatin or something like that, which is more of a digestive enzyme. So it's connected up to the gallbladder, the liver, and the tail sits just by the spleen there. I'll put a little picture up here where it is. Just remembering too that this is coming from me, Michelle. I'm a type 1 diabetic, not a doctor. Though I work as a nurse, this is not coming from my nursing background. These are things that I've just learnt when being diagnosed with diabetes. So there's 4 different types of diabetes. First of all, talk about those cells. Beta cells produces insulin. And insulin is a carrier, a transporter that transports sugar from the bloodstream into the cells so we can use it as energy. A bit like how a car needs fuel to actually operate. Same with our bodies. We need the glucose in cells for energy. And there's one organ that really relies on glucose, and that's your brain. We'll speak a little bit about that later on. But just appreciate how beautiful it is around here. Really good walkway. A couple of people a lot fitter than me, a lot younger too, going for a jog. So back onto it. So insulin acts as a transporter. It attaches to the glucose, takes the glucose through the blood vessels, out of the system, into the cells, into the tissues, so that we can use it for energy. Now with diabetes, the pancreas either has stopped producing those beta cells, they're damaged, that produces insulin, or the insulin just doesn't work properly. Or in some types, it may work a little bit, but not that well. So with type 1, there's 4 different types. Type 1 diabetes are the ones where our insulin just doesn't work. Ain't working. So we've got to inject it. And normally used to be called the childhood or juvenile diabetes. And normally seen in younger people. Some people are 4 years old. And normally it's an insidious, quick, thin, lose a lot of weight, have excessive thirst. These are the symptoms for diagnosis. And because their body's the tissues aren't getting the glucose to function, so the body starts breaking down fat to use as energy. Type 2 diabetes. It's the most common one. Normally family history, if you're overweight, increases, these are the risk factors. Overweight, family history, that's about it. Very common. And they tend to have a lot of complications because normally they find out about their diabetes once a lot of the damage is already starting to occur. There's type 3, which is gestational diabetes. So pregnant women have big babies. Their sugars, I think it's the extra circulation on board with being pregnant, have big babies, got to monitor their blood sugar levels regularly. They might have to have insulin while they're pregnant. And in some cases, once the baby's delivered, they still may have to have insulin. They might get then convert to being a type 1 and have to have it for the rest of their lives. Others, they'll deliver the baby and back to normal. I used to recommend when I did work as a diabetes educator that at the birth of their child they should get their blood sugar levels checked as a reminder, because they are at more risk of developing type 2 diabetes. Then you've got type 4, which is what they call LADA. I have a friend at work who has it. They present as thin but a mature onset, so it's actually called latent autoimmune disease in the adults. Sometimes they can get, it's a slow progress, they're often mistaken for type 2, but the way they present is a lot different, and they usually end up having to go on to insulin. So that's your different types. How is it managed? Well, type 1's always on insulin, okay? And insulin's not something that you can take in tablet form. I just saw on the news not long ago that there's some people in Brisbane in Queensland, Australia, some professor that has managed to find some protein that is taken from the pancreas that they believe might cut down or cure type 1 diabetes. So that's quite exciting news. And they're doing some trials on humans. They've found it's working in mice. But in humans, I think you've got to be over 18 and be diagnosed in the last 5 years to participate. So what they might be able to do is inject these proteins that actually stop the destruction of the beta cells producing insulin. So they might be able to hold it in its tracks. So that's exciting news. So basically diabetes is managed with either insulin, medication and diet. All of them need diet adjustments, or it might be just diet alone in the case of type 2. Type 3, we spoke about insulin. They normally have to go on to insulin. Type 4, the LADA. But basically it's diet, medication, and what people always forget is exercise. It's the easiest and the most effective way, I think, for keeping blood sugar levels stable, apart from your diet as well. So a couple of days ago I was at my local shopping centre and I thought, I'm going to ask if some people just want to give me what they think their thoughts are on what diabetes is. And I'll put a couple of clips in. 2 ladies were the only ones that would want to be interviewed on film, and a lot of the other people said that they would happily talk to me about it and would happily say what their thoughts are and whether they knew people with diabetes, but wouldn't want to go on camera. A lot of them may have been shopping and didn't have makeup on, but it was quite interesting, the fact that women were quite happily to have a chat about it, but men not so much. They were fine when I stopped, didn't put the camera on them. They were fine to have a chat and find out what I was talking about, but just weren't that keen. Not very forthcoming with wanting to answer questions. So, hello. Thanks for agreeing to answer a few questions. Do you know what diabetes is?
It's an issue with the blood sugar, from my understanding, and insulin in the blood.
That's correct. So, do you know how many types of diabetes there are?
Yeah, there's type 1 and type 2, one that you're born with. and one that you get as you get older. I think there might actually be 3. One when you're pregnant.
That's very true. It's called gestational diabetes. I'm a type 1, but I was a late bloomer. I was 21 when I was diagnosed.
That's what Josh has got.
So you know someone that has diabetes. And what do you think it does to their livelihood or their lifestyle? How do you think it changes?
Well, from the limited amount of experience we've got with him, it hasn't made a huge impact. I mean, I think he's got a pretty serious. He has a. Does he have a patch or something on him?
Yeah.
He's supposed to monitor his diet a little bit, but I don't think he does particularly well. But it doesn't affect his lifestyle.
Brilliant. Hey, look, thanks very much for answering those questions.
That's
you have
a pleasure.
good day.
Thank you.
So, hello. It's the Diabetic Nomad. I've just ran into this lovely lady who's agreed to answer some questions that I have on diabetes. So, do you mind saying what you think diabetes is?
Do you mean what is the pancreas? You mean
Yeah.
that sort of thing?
Yeah.
Yeah. So I'm type 2. Yeah.
Right.
Diabetics,
Yeah.
which I was diagnosed about 2 years ago.
Okay.
Yeah.
Okay. And what does that mean to you? What has that has that changed your life? Right
Yeah.
there?
Yeah. Oh, just food wise.
Yeah.
Watch what I eat now, or So.
Okay. So did anyone explain to you what happened to your pancreas for you?
Yeah, but I've forgotten all. Yeah.
Yeah. So really the pancreas is part of the endocrine system as well as the digestive system.
Yes.
And there's parts of the pancreas, mainly the head of the pancreas, that releases these cells called the islets of Langerhans, and they produce alpha and beta cells. Beta cells produce insulin.
Yeah.
I'm a type 1, so my body doesn't produce any
anything.
insulin,
Yeah.
whereas yours probably produces some, but maybe doesn't work as well as it should.
Yeah.
And
I'm on medication. I was on
Okay.
insulin to start with, but I'll stop that now.
Okay.
So.
And do you know how the insulin works?
I did at the time, but
So it works like a transporter. It
Yeah.
transports your glucose out of the bloodstream into the cells, so then the cells can use it for energy.
Yes.
Okay.
Yeah.
Do you have any questions for me now that you've answered some for me?
No, I don't. No.
Okay. Well, look,
Thank
thanks
you.
for agreeing to be interviewed for
Thank
my
you.
channel.
Okay.
And you have a lovely day.
Thank you.
Thank you.
Thank you.
One gentleman actually said to me, "Geez, you're in good shape for a diabetic. You're not fat at all. Did you lose a heap of weight?" And I said, "What made you think that?" And he said, "Aren't most diabetics fat?" And I went, No. Most type 2s can be overweight, and it certainly predisposes you to the illness. But now I've got type 1, and that's a whole different kettle of fish. So let's talk about hyperglycaemia. So that's high blood sugar levels. They say that the renal threshold, meaning the kidneys will start damaging your kidneys if your glucose is greater than 10 millimoles. In Australia, we call it millimoles, and it ranges from the normal is between 4 to say 8, whereas in the States they use different measuring system. A bit like where metric can use kilometres, they'll use miles. Same, just a bit different. Hyperglycaemia. So if they're left high for a certain period of time, they cause complications with your eyes, your kidneys, your circulation, and because of the effects on your circulation, it can also affect, you get a lot of diabetic foot ulcers and also some nerve issues as well. And there's a couple of other things that can happen too. Gingival recession, which is your gums start to recede, and it's all to do with that circulation issue. So it's not life-threatening if your sugars are up for a little bit. However, in the case like myself, my blood sugar levels was 37.7 when I was diagnosed. And they reckon if I hadn't have made myself go to work that day, and if I had gone back to sleep, I probably wouldn't have woken up and would have gone into a diabetic coma. So ketoacidosis, where our bodies relies on a balance with all of our trace elements, our pH system, the buffer system. Don't really know how else to explain it for all viewers or for those that are interested. Have a look it up, just like I'd have to do. But your pH should be between, normal is about 7.35. Some kids going past on their bikes, with mum and dad driving. Good to see they're out and about, and not in front of the TV. Where were we? About acidosis. Yeah, so it can make you really sick and you can become unconscious. But that takes days and days of your sugars slowly climbing up. Let's say I didn't have my insulin for 3, maybe 4 or 5 days. I probably would then slowly become unconscious. Whereas your hypoglycaemia, and that's when your blood sugar level drops below 4, and remembering that everyone can have hypoglycemic attacks at different levels. The norm is about less than 4. You start to feel symptoms. Remembering I said that the brain is the real organ that relies on glucose. So if you haven't got enough glucose running around in your blood system, your brain's not getting fed glucose. And the signs and symptoms of that will be agitation. You might be really pale, sweaty, can't string 2 words together, irritable, or as my partner describes, I just get bitchier than normal. And you can't describe to people, I think the best way to describe it is if you stand up, you feel like you're going to fall down, and a real great fear of impending death. So that's more of an acute thing that has to be treated, and that's more life-threatening. If you go into a coma, it'll knock off all your neurons, all your brain cells. You may not wake up as good. And yep, I've left myself open there. Maybe it's happened a few times to me, who knows. So that's hypoglycemia. That's why you've got to eat regularly, eat the good stuff. So you want some carbs, not heavy, dense carbs, but you want to have carbohydrates that are not acute acting, like your simple sugars, your lollies, your honey, fruit juices, some fruits, jams, all that sweet stuff. They're classed as simple sugars. Your complex carbohydrates, otherwise, they're actually more long-lasting. They take longer to slowly break down and get into your bloodstream. So it's a gradual thing. And the higher the foods are in fibre, fibre acts like a chain around the glucose molecule. So what it actually does is it slows down that only, bits of the chain breaks off and some of the glucose is released. Others will stay attached because they're restricted by the fibre, and then a little bit later, a little bit more will be released. That's the best way to look at how fibre acts with complex carbohydrates. And carbohydrates, remember, is the sugar part, whether it's the complex or the simple sugars. That's what carbohydrates are. And you'll find them on your nutritional guide. So if you're a diabetic and you start reading labels, things that are high in fibre, take the fibre grams away from your carbohydrates, and that's how you'll get your total net carbs. Also protein. Protein's really important because protein has very much the same effect as what the fibre does. Whereas fats aren't good for us, apart from some fats. But fats a lot of the time will slow down that movement of glucose and insulin between the blood vessels going into the tissues. So that can interfere with the way you absorb your carbohydrates and also the way your insulin performs as well. So as a diabetic, you've got to take into consideration the fats that are being consumed. What else? So hypos. How do you treat them? So if you know someone that's got diabetes or you're a diabetic yourself, quick acting insulin. Don't leave the person alone. If you've got a friend that is, make them sit down. They may not want to, but you've got to be forceful because their brain can't be making decisions for them. As you know, or as I've said, I can't be told much when I'm having a hypoglycaemic attack. And with my mini Medtronic pump now, I have very few. In fact, the last week, 4 days out of 7, I've been 100% time in range. And other than that, it's been between mostly 95 to 100. And I've had a couple of days just recently now where it's been 90 to 95. And that's only because I've been eating some other different stuff. Anyway, a lot of it is trial and error, especially when you want to try different foods from different countries and whatnot. So where do we get up to? Hypoglycaemia. So really important to sit them down. And every diabetic, especially your type 1s, got to keep something sweet on you at all times. Eat small, regular meals. And always carry jelly beans, which I can't stand, so they're useful. I'd just spit them out if someone fed them to me. So I tend to carry lollies that I know I'm going to eat and that are easy to eat, something you don't have to chew for too long on, or a little tube of honey, because honey gets absorbed quickly into the mucosal lining of your mouth, and so will get into your bloodstream quicker. So give them a good 15 grams of simple sugars. That might be a good handful of lollies, or 100 mils of glucosade, or if you've only got a can of Coke, get them to drink about, half a can. Wait for 15 minutes. Get their sugars checked, either by pricking their finger or if they've got a sensor with their phone, making sure that they're checking that. But also follow it up with a complex carbohydrate. Either a piece of fruit, a couple of biscuits, your next meal, a sandwich, glass of milk, anything so that you can keep those sugars up for a bit while they have the next meal, and be conscious enough, alert enough to be able to decide what's going on and what's happening with their blood sugar levels. There's a lot of reasons why they can go low. It could be the fact that they've had too much insulin, miscalculated how many carbs they've had. Could be activity, sport. Got to be mindful of that. Make sure your sugars are a little bit higher, or making sure you're having a bit of a complex carb mixed with a little bit of simple just prior to doing that exercise. Or like me, just put your insulin pump on suspension for that time. So you've treated it like that. That's if they're able to actually eat something when they've had a hypo. If someone's unconscious, you can always get some honey on your finger and rub it into their gums. You don't want them to try and force them to swallow anything, because if they're unconscious, it's just going to go into their lungs and cause pneumonia, aspirate pneumonia. So you can try rubbing it into their gums, or if you're a family member or a friend and know how to inject the glucose injections, which really good diabetics do keep that on them. I don't. I've never had the need to. But when I travel now, I am starting to consider taking that with me, as you should. And then, cool 000 here in Australia. call your emergency line to get someone there if you can't wake them up. Maintain an airway, keep them positioned on their side in case they vomit, and yeah, like I said, maybe try and rub some honey on their gums. That might get a kickstart, getting them awake enough anyway to be able to eat something. When people are in hospital, when they're sick, they actually need more insulin, not less. You should never withhold insulin, not unless your diabetes endocrinologist or GP advise you to. What else was I going to say? I think that's about covers it for today's chat. Now I'm just going to jump back on my bike, my trusty little steed. I'll get a little bit closer. So this is my little scooter that I scoot around in, drive it every day to work. And what I might talk about in the next vlog is what to do as a type 1 diabetic or any person with diabetes, especially those that are on insulin or medication, is the process about when you get your license, but also about riding a bike or driving a motor vehicle. Okay, thanks for listening, and I hope you all have a really great weekend and a great day.